In the past decades, the United States has seen a huge change in the way we view mental illness. While the culture and political climate of our nation has moved toward a more progressive viewpoint, the way we treat the mentally ill has failed to keep up. The topic of mental illness, formerly very taboo, has become something much more widely accepted. While we as a nation are seeing much more openness and willingness to discuss mental health, our mental health treatment remains insufficient. In my own experience, I have witnessed friends and family members exhaust all possible methods of treatment due to inadequacy and unaffordability. In response to this, I propose 3 methods of change. First, a policy change, which will result in the separation of primary care health insurance and mental health insurance. Second, a more personalized approach to treatment, in which the patient keeps a daily journal of their progress, or lack thereof. Third, a greater prevalence in creative methods of treatment, including play and music therapy. In our country today, we are seeing a prevalence in insufficient treatment in regard to mentally ill patients. Although the topic of mental illness has certainly become more widely accepted and discussed, the current level of treatment available to most working-class Americans has led to a cultural divide between mentally ill patients and mentally healthy members of society. This issue is now becoming an epidemic in dire need of a resolution. According to DJ Jaffe in his book titled Insane Consequences, in the year of 2017, the mental health industry spent $147 billion, while of the 10 million seriously mentally ill adults in America, 140,000 remained homeless and 390,000 remained incarcerated. Even with this extensive spending, patients still receive incomplete to no treatment. Because of this, many mentally ill patients are faced with unequal opportunity when compared to mentally healthy Americans, as well as restriction on the way they live their lives. This issue, while prevalent throughout the United States, has the most impact on low-income communities. These communities often do not offer treatment specific to mental illness, and even when targeted treatment is offered, it is either insufficient or unaffordable to the patient. This has led to further social inequality in areas where it was already present. This issue is becoming a deep-rooted, structural problem which is preventing the mentally ill from assimilating into American society. This is an issue which is not only impacting Americans who suffer from mental illness, but the friends and families of those without proper care and treatment. Because this issue has become so vast and widespread, action needs to be taken to change the way in which our country treats the mentally ill. The first step that should be taken in the reformation of this industry is the separation of primary care and mental health care. In a 2010 study published by the National Ambulatory Medical Care Survey, it was reported that 20% of all primary care visits were due to a mental health concern. These visits include, but are not limited to, a mental illness diagnosis, mental health screening, or the prescription of a psychotropic medication. According to Merriam-Webster dictionary, primary care is defined as health care provided by a medical professional, such as a general practitioner, pediatrician, or nurse, with whom a patient has initial contact and by whom the patient may be referred to a specialist. Oxford Dictionary defines a psychiatrist as a medical practitioner specializing in the diagnosis and treatment of mental illness. By these definitions, patients experiencing mental health issues should be visiting primary care facilities to be referred to a psychiatrist, not to receive direct treatment and/or diagnosis. By separating primary care and mental health care, patients receive the care that they need, not simply the care that is convenient or affordable to them. While it may be argued that if mentally ill patients are receiving diagnoses and treatment from primary care physicians, a diversion from this process would be unnecessary and a waste of money. However, a separation between funding for primary care and for mental health care should be nothing but beneficial. In the state of California, a Mental Health Service Act was passed in 2004, which generates hundreds of millions of dollars annually to fund mental health treatment services simply by implementing a 1% income tax applicable to only personal income greater than $1 million. All revenue generated from this tax goes directly to prevention, intervention, and rehabilitation funding strictly for mental health services. This act is completely separated from any form of primary care funding and has been nothing but successful and beneficial. Another step that may be taken to ameliorate this issue is to allow for a more personalized treatment plan for mentally ill patients. By allowing patients to log their treatment process in a journal, psychiatrists and other social workers will be able to assess the progress of the patient as an individual, not simply as a blindly led protocol. Many treatment programs are unsuccessful because of their failure to advocate for and to cater to the individual needs of the patient. In many cases, this may lead to patient discouragement, or what Gert Schout refers to as patient care avoidance. In his article, published by Sage Productions, Shout defines this issue as an act of discouragement or avoidance by the patient, resulting in lack of participation in his or her recovery process. This may be displayed by intentionally not attending appointments, being misleading or deceptive while discussing their progress, or refusal to be treated. These situations often occur because of negligence on the hand of treatment specialists. By implementing a more personal form of treatment, doctors will be able to gain the trust and cooperation of their patients, resulting in more successful treatment outcomes. One may object here that a more individualized treatment plan may be ineffective and that the patient may feel singled out or fear to be perceived as more quote-unquote sick than they believe themselves to be. However, by creating an individualized process specific to the needs of a patient, he or she would be receiving the best degree of care necessary for his or her recovery. In addition, journaling or documenting their feelings and thoughts throughout the recovery process will allow the patient to build a foundation of self-awareness and self-advocacy. The third action that I am proposing to be taken is an increase in prevalence of creative methods of treatment. In Brooke Allen's study titled Aesthetic Phantoms, it was concluded that there exists a correlation between mental illness and high levels of creativity in such a way that anticipates a mentally ill person to possess very creative traits. Because of this association, treatment involving art, music, and/or writing should be more beneficial and enticing than traditional treatment. By treating patients through activities and skills that come naturally to them, they will likely be more willing to participate in their recovery process. In addition to higher treatment success rates, this approach to treatment will also result in the patient finding a sense of purpose or role in society, therefore closing the gap between the mentally ill and the mentally healthy. While this method of reform allows for mentally ill patients to assimilate into American culture, it may be argued that these people are incapable of living amongst the conformity of our society. Currently, there are thousands of mentally ill Americans living in relegation in motels, according to a 2016 study done by sociologist Christopher Dumm. After extensive research, Dumm was able to conclude that although these communities may seem functional, a majority of the people living in this type of environment only do so because they were left with no other option. Although these people are mentally ill, proper treatment, rehabilitation, and recovery will allow them to become fully functional adults. Although improper and insufficient mental health treatment has become a deep-rooted issue in the U.S. today, there are still actions that should be taken to ameliorate it. Policy change is necessary to separate insurance and funding for primary care and for mental health care. Therefore, we must call our local representatives and legislators. We must promote self-awareness and self-efficacy by trending hashtags such as #StopTheStigma or #TimeToTalk. Effective and affordable treatment must be available in all communities. Therefore, we must support and promote local therapists who practice methods of creative and play therapy. Ultimately, a healthy mind is just as important as a healthy body. Mental health deserves the same consideration and attention that physical health receives, and in order to make this change, we as a nation need to take action. With proper reform, we can set a new standard for mental health treatment and eradicate the stigma that exists against the mentally ill.